Okay. Hello, everyone. Well,
Hello. Hello.
welcome to the April NOFAS Policy Forum. Good to see everyone. We still have people joining us, and we have a lot of information to discuss today. And I know that we have on here from the NOFAS policy team, Susan Carlson, our chair, and Jen Wisdahl, and you'll hear from both of them. And we also have from the NOFAS team, Susan Ellsworth, who's the director, the coordinator of the NOFAS affiliate network. And I'm Tom Donaldson at the NOFAS office. So we see a lot of recognizable faces and some new folks as well. So we're excited. And I want to remind you, everyone is invited to this virtual meeting every month. So please continue to attend yourselves, and please everyone within your organization, anyone that are part of support groups that you may participate in, remind them, let them know, send the link to them, tell them to join. And if the time isn't convenient, you will be able to see the recording for all of these forums from the NOFAS website under NOFAS Policy Center. So you can see the recordings from the first three, January, February, March, and then the recording for this meeting should be posted by Friday.
Yes.
So let me just ask everyone to mute while we are just sort of updating you and presenting. We do then have planned plenty of time for your comments and feedback and questions, whatever it may be, as part of the conversation. So as I said, it's open to everyone, but we also are urging folks to sign up, if you will, so that they get the emails, and it allows us to have your name associated with your member of the House of Representatives and your location, so that Jen on the NOFAS team can sort of match you up with key lawmakers that we need to reach out to. So please, also from the NOFAS website under Policy Center, you can click on just a form, very simple, to just take you a moment to put in your name and your congressional district and basic information. And another thing to look out for that we're going to post there, and will also be in this upcoming roundup, because often people ask about the federal response to FASD, and you may have heard us mention, you may be familiar with the Interagency Coordinating Committee on Fetal Alcohol Spectrum Disorders, ICC FASD. That's been administered for, well, since the 90s by the National Institute on Alcohol Abuse and Alcoholism, and they just recently held their spring meeting open to the public. So that was video cast, and we'll have the recording from that video presentation that will be in the roundup, and we'll post on the Policy Center. And I urge you to take a look at that. Yes, it's a I think it's a 4 or 5 hour meeting. There's some really interesting presentations that go in depth on the really alarming increase in binge drinking, particularly among women. Talks about the sort of the demographic and who is drinking more these days. And it's particularly concerning when you look at the women of childbearing age and alcohol consumption rates. So there's a presentation on that and some other really terrific lectures and presentations and discussions. And the other thing that's so important is each of the members of the ICC-FASD, and that's comprised of a representative from various federal agencies and departments. So beyond the Department of Health and Human Services, Department of Education, Department of Justice, and with a focus on the agencies within the Department of Health and Human Services. You hear us mention CDC, NIAAA, HRSA, or the Health Resources and Services Administration. And you get to hear short little updates from representatives from those agencies or departments talking about, unfortunately, not so much what they're doing regarding FASD, because many of them don't have funds, but the role they could play and the things they are doing, even without money to put out into the field for grants and contracts with all of us. So in the process of gaining knowledge and educating yourselves about the federal response and this bill and what we're trying to do and how we're trying to add money or include money, it could be very, very helpful. So look at the ICC FASD meeting. Okay. enough of that, enough of me. So let me turn it over to Susan for an in-depth update on all things FASD legislation.
Thanks, Tom. It seems like it's been a lifetime ago that we last webinar. I was talking, Jen and I did a webinar with Natalie Vecchione last night, and Jen actually started, I think it was March 8th, and we've had meetings, and she's had lots of conversations with advocates all around the country, but we've had meetings and conversations with 22 states, which in a month and a half. I mean, it's incredible. And I want to thank all of those that are watching and will be watching for your advocacy and helping with those meetings. We've learned a lot. And I must say that it's those meetings are helping form the bill. I know the last time we said we were hoping to get it to agency technical assistance and introduction. Unfortunately, that hasn't happened. We're still waiting for technical assistance, particularly from Alaska and the tribal, and that's hopefully will be done by this Friday. And so when we get the final technical assistance from all that's out there, we will go over, and I've been doing that since well, it seems like for months have been going over the language in the bill, and since the bill was introduced last time, we've rewritten the section on justice. We've rewritten the section on building FASD state systems, and we've had a lot of discussions about what people that I didn't realize was such a big deal, but I guess I did at the time when we had the FASD Center for Excellence years ago, and that had to do with the language evidence-based practices. Because if you've been in the system for a long time, you know that our field doesn't have a lot of evidence to base practices based on research. So we're really cognizant of that because there are a lot of good, what we call best practices or promising practices. So we want to make sure that those are reflected in the language of the bill. But it's a lot of tweaking of the language and making sure that that input is reflected in a modern day version of what we had. So I can understand where there's some confusion out there by advocates about, because they have the old language and a new summary. And we hope to have a bill, like I said,
so far so good,
by the middle board at the end of May.
Drink a lot of water, and so yeah.
Can we mute
so far so good, but probably won't.
Sarah, can you Sarah, can you mute? Okay. So as soon as the bill goes to the agencies for technical assistance, that'll be about a week, and it'll go to.
I didn't have that, so we'll see.
For drafting, and I'm unmuted. Okay, sorry. And the timeline is getting shorter because we want to get a bill introduced so we can have a committee hearing before the August recess. So and you can see the timeline here, and Jen will go in more detail on what that means to you. But so that's where we're at with the advocacy. We've had meetings since last month. We've had Florida, Maine, Colorado, Massachusetts, Hawaii, Texas. We had an excellent meeting yesterday with Congressman Ronnie Jackson, who you call was President Trump's physician. He was elected last election. He's chair of the Physicians Caucus in the House, and he said he will bring this up before the physicians caucus, and he was very supportive of our work. We have a meeting this afternoon with Senator Collins. Our first senator actually will be there thanks to the main advocate. So there's a lot of excitement out there and a lot of activity. But and one of the things that seems like a small change to the bill, but it's in the definition, because as we listen to advocates, we hear how getting services, because it's not in the definition of whatever in the developmental disabilities for those services or idea. I thought a simple step would be to put in the definition that it is a developmental disability. So once that bill, the language is out there, then states can use that as, I mean, it's in the science, but it's Congress saying this is a developmental disability, and so states can use that in their advocacy efforts. So as we're going on, I thought it would be good. I know there's been a lot of people that have been on this, but if we have some new, I wanted to go just back to the basics, why we're doing this. Next. So these are generally, it's going to provide resources to states. And I think this is probably the most important section, and that's the building FASD state systems. And we're going to do a deeper dive into that section today because it's been totally rewritten. And I want to have you all understand how this could impact you, families, and professionals in a major way. And there's also resources for best practices. So, and these would be, you would apply for those. Proof Alliance went with Boston Medical College. There was $1 million that went to HRSA, and I'll talk about that in a little bit. There was no language on that. They had the money, and they came, and HRSA came up with their request for proposal. And so it would be the same kind of under that section where it would be where you would have requests for proposals for those two areas. Throughout the bill, there's language that all of these trainings and whatever is going on have to be FASD informed. And that includes training professionals in many, many systems of care. And then there's a Center for Excellence that will take what we've learned in states from the best practices and the community partnerships and from the states, and be able to replicate that in states that don't have systems of care around FASD. And it's going to tackle the issue of diagnostic capacity and what diagnostic capacity may look like in the future. And then finally, there's a vehicle to develop a national FAS agenda to look at where we've been, where we are, and where we need to go. And when we started this, this is a house that I just came up with, but we're building that foundation. And as we get that foundation developed, and we build on that success in what I call Systemize FASD, so that the systems begin to recognize that FASD is a disability, and individuals and families need support. And then the roof is, we finally get there where it's understood and those impacted are accepted, supported, and it's widely understood. So that's back to the basics. And now we're going to do a deep dive, and then I don't want to. So these are existing federal FASD programs, and Tom talked about these agencies. So currently, and these are in the bill because we didn't want to leave them out. And so existing funding for NIAAA to do the research, which Tom said they've been doing since the mid-90s or before, is $30 million. The bill continues that. Center for Disease Control is $11 million, and they do prevention, surveillance. And in our last meeting with staff, we were asked to put numbers to the sections. So we did that, and we added 2 million to the CDC. The Interagency Coordinating Committee that Tom talked about, it currently is supported by the NIAAA, but there's not an appropriation. So we authorized $1 million for that. And they've been really instrumental in a lot of innovations over the years. If you, they did, I was on the Justice Work Group, and we did the ABA resolution. There was the NDPAE, which got that into the DSM-5. So there's, and that's, so that we're continuing and putting that as an authorization in the language. And then we've got new programming, new funding. And most of this new funding is going to HRSA. And these are the new numbers. And the bulk of that is going to that section on building state systems of care. And there's going to be, and I need to say, this is a draft, you know, these numbers can change, and we're going to, it's getting the language, the authorization of language taken care of first, passed through the policy committee, and then go to the appropriators. But at least this gives them an idea of what we would like in the field. So it's more than what we've seen before, considerable, I would say. So 33 million to that, and then a set aside of 9 million. So every state could have money for administrative costs to do the task force, to do some training. There would be additional funding for those states that are ready to access, want to do a request for proposal, to do some like a PCAP, whatever. There's a whole list, and we're going to go a deeper dive into that. And those are the rest of the funding measures. Now, the Indian Health, that may be folded. Originally, that was under the state systems of care. We may be folding that back into that building state systems of care, not having that as a separate section. So let's move on to the deep dive. So these are, well, additional federally funded programs. SAMSA, that's the 10 million for services. And this is to develop best practices on how the system, and we're not going to go in, we're going to do a deeper dive on these different sections each time, so you'll have a better idea exactly what they're doing. So I'm not going to do it here. As I said, the Department of Justice was totally rewritten, and I'm excited about it. I think there's going to be some, it's going to help do a lot of training of all sorts of professions in the justice system. And then we've got the Centers for Excellence and the Advisory Council. Okay, now the deeper dive. HRSA. Okay, so what's HRSA? Because people say, you know, you hear all these acronyms. And so we've got the mission, and they do the Autism Funding, which is under the Maternal and Child Health Bureau, and the funding, and we'll talk about the Proof Alliance and Boston Medical College they do that. And so it's a natural place for a lot of that funding to go. If you look at the mission, to improve the health and well-being of Americans' mothers, children, and families. In America, all mothers, children, and families are thriving and reach their full potential. I would put fathers in there as well. Okay, next. So, and there's lots of different things under HRSA, but this is the program that actually NOFAS advocated for additional funding to go to HRSA, and we were able to get the 1 million, and that's called the Safest Choice Learning Collaborative. And I think it would be good in a future webinar to have Sarah and Proof Alliance or Boston to talk about this and how it's going. I think but that's how we learn, and that's how we get, best practices and replicate it. Okay, so this is the new Building FASD State Systems of Care, and I'm calling it the BFSSC. I like that because it ends with SSC, which are my initials. So as I said, states are going to apply, and this is the purpose of the state systems of care. And I think what's really important about this section is we're not just saying you need to train about FASD. It's really a system of care, and how does FASD fit into that system of care? And it's both prevention and intervention. Next. So what do states need to do to begin this process? And that's why it's really important for advocates to understand that they can be instrumental in helping states. So they have to have a lead agency. It could be health. In the Minnesota Health is the lead agency for the Proof Alliance funding. So it has to be an agency that's going to lead the effort. And then they have to show establishment of a state FASD advisory group of state agencies. So those are the agencies where FASD would, programs would, different programs would be. And so the governor or would initiate this through the state agency, and they would have to identify those state agencies that are going to be on that state FASD advisory group. Now, the thing about legislative drafting, you can't put every single little detail in because but you want to give guidance. And like I said, the previous 1 million never had any authorization language. It just was $1 million. And I was very impressed with what HRSA did with that without any language. Next. And beyond just the state agencies, they need to develop, the agencies and a public-private sector stakeholders need to develop a public-private, diverse, multidisciplinary coalition that's going to build this FASD state system of care. And you can see under the public and private sector stakeholders that it's really broad-based. And it says including but not limited to. So if you don't see it there, if we miss something, that doesn't mean that they cannot be on part of this coalition, and it really is important that it be public and private. That's the key to success. You don't want this just to be a government, and FASD advocates, caretakers can really be instrumental in figuring out who should be in that section, and write letters to to the governor and to your legislators. And if you have relationships with agency folks, that would be important. Next. So this coalition is going to update or develop, implement, and evaluate a state strategic plan. And there have been states, when we had the Center for Excellence, states did develop strategic plans. But as we were meeting with around with advocates, a lot of those have lost their funding from SAMSA, don't have funding through the state. Their strategic plans are just kind of sitting there. So this would be the opportunity to update and develop and implement and evaluate. Evaluation is really important. And there's this will be on the website, so you'll be able to look at it in greater detail. But these are the strategic plan. These are the items that we're putting in the bill that states will need to include in their strategic plan. Now, I know when we originally drafted language, we were told, oh, you're being too prescriptive. And, it's like, well, if you're not prescriptive, are you going to leave it to the agency to tell the states what they should develop, or are we as advocates and people in the business, should we know, and we want to make sure that these things are included. And I think what's really important, that this is across the lifetime issues for individuals and families, that it's not just children. And I think what's also important is identifying systemic and barriers to the integration of prenatal alcohol and substance exposure in all the screening, assessment, identification of those with FASD. And so, you know, there's probably programs out that are screening for opioids or other things, but for some reason, FASD, as we all know, gets left out of the equation. So this is to identify all those programs, because there could be funding that could be utilized by the state in doing what they want to do. Next. And this is not going to be just one of those reports that sits on and collects dust. It's got to have, you know, action steps and deliverables for improving social determinants of health. And that, so it's looking beyond just FASD, and it also includes other conditions related to prenatal substance exposure, because as we all know, it's not just alcohol, there are other substances, and states have been doing a lot of things with other substances. I know Florida has, through their maternal and child grant, they do tobacco, you know, prenatal tobacco exposure. So it needs to be holistic in including all of those and folding in prenatal alcohol where it's been left out. And here we get into the integration and I talked about it earlier about evidence-based practices, promising practices, practice-based evidence. So we want to make sure that we don't limit it just to those research-based, evidence-based practices, but also those that have been developed in the field. And again, across the lifetimes. Next. Okay, so now we get down to the, you know, the nitty-gritty, and that's how can you use the funding? And there's a whole laundry list, and it's like, well, maybe we should just say you can use it however you want, but we just put a lot of things out there. Whether they will end up in the final version of the bill, we don't know. But and so these are obviously top and center is diagnostic capacity, and that's one thing we learned from every single meeting, is that some states have none, some states have better systems, but they don't have the capacity to deal with the problem. And also, I think top and center is we've got to provide support to families and individuals. We can't just keep it what I call admiring the problem. We really need to provide support. And you can see the list. I think every state should have provide for a state FASD coordinator. And the idea is that would be part of the set aside money that every state could have a state FASD coordinator. That would be in the 9 million that I talked about earlier, set aside. And so you can see that's, and here we go. There's a lot of money here for training and of various professionals. The peer-to-peer certification programs, that's, I didn't know what that was. That came from Alaska, and that's those with FASD to be able to train each other, I believe. And FASD informed, because throughout the bill, we talk about FASD informed. Maybe, and this came, I believe, from Sarah from Proof Alliance, that maybe we need to have a certification program that you can get certified if your program is FASD informed. And then finally, each you could implement recommendations of the advisory group. If it doesn't fall in that laundry list of recommendations, the advisory group can make recommendations. So that's kind of it, I believe, in a nutshell. Next. Oh, and finally, we really felt strongly that we need to learn from the states and learn what the barriers are. Congress needs to learn, rather than just giving money and saying, you know, good luck, we hope you succeed. States are going to have to provide feedback, and this is what we have this far on what they have found, particularly regarding the systemic and other barriers to screening for alcohol and other substance exposures in existing systems of care. And how many states are receiving grants, information about existing programs. And we may, as we go through this process and it goes to technical assistance from the agencies, they may say, well, we can't do that. They can't do that. This is too prescriptive. So this is where we're at this time with this draft of this bill. I think that's it. Advocacy, what's next? That's Jen. Unless, if we want to take some questions, I haven't had a chance to look at the chat. We can do the advocacy and then take questions. How are we doing on time?
We are great on time, and I think it would make sense to maybe answer some questions about the bill before we push on to advocacy, if that's okay.
Okay. Okay. I hope this makes sense to people, because I know it's been hard for advocates to look at the old language and not really understand where the bill's going. And that's why I really wanted to do this particular section, because I think it's so important. So, we don't have all the I's dotted or the T's crossed, but I think we're getting there.
Can I ask a question?
Sure.
Okay, it's Lynn Becker from Pennsylvania. I certainly credit the researchers that CDC supports for the work they've done in the past. Some of it's been really phenomenal findings.
Right.
But when I go back and I look over research for the last 20 years, I see pretty much the same researchers involved. And I'm just a person who thinks you need fresh new ideas sometimes, people who've been trained differently, trained in other countries or whatever. And will this setup that we have in the current wording of the bill help us to gain, researchers, fresh new researchers who can think of other things? And maybe I hope I'm making myself clear. I don't want to show disrespect for any of the researchers we've had, but I think, I don't see too many new names coming up, and I don't know how they're selected, but there are so many more problems out there to solve than some of the ones that the ones that have been working for 20 years on this have solved. That I've parented 3 people who have an FASD, and none of them, I have no biological children. So they have a variety of problems that aren't being worked on as far as I know. They're adults now, and I would like to see something new and fresh go on. I'm just asking that question.
Yeah, no, I think that's a great question, Lynn. And I do believe that this bill does provide that opportunity for new researchers, particularly in the best practices and the community partnerships, because it's looking, it really is looking at interventions. And the CDC, as you know, is primarily prevention. And so, we haven't done a lot with intervention. And so this bill really is focused on intervention and taking what we learn and making sure that what we learned can be replicated. And that's why it's so important to have the Center for Excellence to be able to take what we've learned through the best practices and the other sections of the bill and use that in the states. So the states say, Minnesota does such a great job with in the Proof Alliance with that HRSA grant. Whatever that is learned from that can be replicated through technical assistance in the Center for Excellence to other states. But I do think there's an opportunity, and it's a competitive process. I hope we have a lot of good young researchers out there that have been kind of in the field. I think there's going to be some opportunities and some money to do good interventions.
Great, thank you. And also thank you so much for putting in the language about promising practices, evidence evidence-based practices and practice-based evidence. I thank you so much for that.
You're very welcome.
And I might add to that, Lynn, to your question, because it's such an important one. It's so important to note that 90, 95%, or the vast majority of new money that will be asked for, should the authorization go through, are for the things that, you and we were all talking about, the services, transitional services for individuals, something beyond research, real world action that improves outcomes. And I'll also say that there are some terrific newer or younger researchers who are increasingly looking at research for interventions and not just what you might think of as the biomedical or behavioral research that NIH does. So it is very exciting but your point is a very important one, that the researchers have basically driven our field since the FAS and then FASD were identified 50 years ago. And the entire basis for the work that the NOFAS policy team is doing, and all of you, is to put money in other places that actually helps people.
Yeah, there's kind of a disconnect between the researchers and the research and the everyday living and parenting of these children.
Yeah.
And one of our researchers said to me that I've learned more from talking with parents than I have in doing 20 years of research on brain research and stuff. And I'm not saying that that's not important, but it's time to work on, focus on this side of it, I think.
Yep. We agree 100%. Anybody else?
Susan, this is Kathy Hoteling. I'm really glad to see the money going toward more diagnostic capacity. I know in North Carolina, we have essentially 2 sites that do diagnosis one day a month, or 1 day a week, I'm sorry. And it used to be less than that, but we're undertaking some efforts here that have the potential of flooding these diagnostic centers, which they already have a good size weight. And I think that's really important that we have some federally funded capacity to diagnose, because we know that so few are diagnosed, but you also have to find a place that you can get somebody in. So I appreciate that very much. Thank
Well,
you.
I think we have to imagine what the future will look like in this field, because it won't be static. And maybe, it's going to a system where we don't have, that you could have kids receiving services, not, through their primary care provider. And Sally Anderson talked about this at the ICC FASD meeting and so if there's enough evidence, they can start receiving the different services without, before they would get the final diagnosis. And, how, maybe with technology, things can change to make it much more of an easier and cheaper process to get kids the help that they need.
Mhm.
How do these funding requests or amounts compare to the autism, what they get?
It's not as much, but we're getting up there. I just, HRSA gets, quite a bit of money, and CDC gets money for autism. But I think this is gonna, I think we're close to what HRSA's autism program is.
Because we know we have triple the population of that.
Oh, I know.
Like, I'm wondering, are we aiming too low with the funding request or not?
Well, and as I said at the beginning, this is the start of the process. When we started this, we were at 42 million, and then the last conversation, and I keep hearing, as we're meeting, and this is from staff, and sometimes even Congress, that, maybe we're not, I think this is the floor. Maybe it could be more. I don't think it's going to be less. So, but the thing is, you don't want to get a lot of money, and then it's going to take a little while to administer this and filter it through the system.
Totally, yeah.
You can't just give them, give all the money out there, and then you're not able to to make it work right away. So I think it's better to, to start and build. But we'll see what happens as we go through the process. But we welcome always, you guys have been terrific in helping.
I think on the last meeting, somebody pointed out, or the previous one, what the numbers were for autism, and I could never find that information. I don't know if anybody knows where to point me, but I never found it.
It's about 1 in 58.
No, I mean the amount of funding.
Oh, I'm sorry.
We'll put together a spreadsheet, a little chart with that amount. We do, for instance, CDC has 23 million for autism. They have 11 now for FASD. We're asking for more. HRSA has about 40 million for autism. We're asking for around 40 if you add the numbers together for the provisions to go to HRSA. So we have the NIH number for FASD, which is around 30 million. We'll put together a little chart with that data by agency.
Okay, thank you.
Yep, that's a good idea. Well, should we go to Jen? And then we can come back if we've got some time.
Sure. And Susan's a hard act to follow. I just have to say, going into this, just looking at the lengths to which Susan will go to make sure the verbiage is crafted so carefully on this act. As a mom, I just have so much gratitude towards the thoughtfulness and the intent that's going into this. So thank you, Susan.
Oh, thank you.
So, what's next? What do we do now? And the state systems of care piece really, it's the largest chunk of this legislation. And we want to make sure that once this legislation passes, because we're going to make sure that once it passes, we're ready for that these funds aren't being wasted or spent in a way that doesn't work for our community, the FASD community. So we really need to be looking at a top-down, bottom-up approach. We're looking at federal advocacy and getting this federal bill passed so that the funding is available there for the states. But we also need to be looking at the state systems and making sure that we have a clear and accurate view of what's going on in our states, so we can then use that money wisely, and we can apply for that money. We can be ready for when that funding hits. So as always, with anything that I'm proposing for advocacy, this is not prescriptive. This is not telling you what to do in your state. This is providing you with an outline that might work for you in your state based on what's worked in other states. So please feel free to tailor this to your state's needs. And again, every state is going to be a little bit different. So looking back at the timeline of the bill, where are we at right now? Hopefully very close to being reviewed by agencies and introduced and assigned a bill number. Timeline in our advocacy. We are really kind of in steps 1 and 2. And in step 1, and this can now start applying to all states as opposed to just the key states, but we really want to be looking at, they have the advisory boards, the state advisory boards on the building state systems of care. This is a good opportunity to start building that a little bit for yourself, finding out in your state who else is working on FASD, who else is impacted by FASD, who are the connections at disability rights organizations, who are maybe some connections in your education departments that are either more FASD informed or FASD friendly. Just building a coalition in your state, building a group in your state that is talking about FASD or is aware of it, and starting those conversations. Your state team can be working on building your state or refining your state leave behind document. that can be used for federal advocacy, and it could also help with state advocacy. We could tailor it for that too if you wanted to. Members of your state team can participate on calls with your senators and representatives. Reaching out to your state government, just again, getting that ball rolling, because ultimately the states are going to have to apply for this funding. Well, if the states don't know this funding is coming, if the states aren't ready for this funding to come, it's not going to work. So that's part of the bottom-up approach. We need to be looking at the state government too. So that state team can serve as a point of contact for state advocacy as well. The state leave behind document, and I know many of you have already seen this, many of you have already refined yours, but one of the things you'll notice in this document is it kind of mirrors the process of what your state task force is going to do. It's looking at what systems of care can be impacted and integrated to become more FASD informed. So many states right now, when they're doing their state leave behind document for use in the federal advocacy for the FASD Respect Act, they're simply doing the first page because they don't know what systems of care might be affected or impacted or could use the funding once the bill is introduced. So if you have a state team that can be, even if it's just meeting monthly to talk about this and figure out the pieces that might be impacted, that's a good way to go. So the state leave behind document, page 1 outlines the problem. When it's sent to you, everything that's in green is already filled in. We fill in the statistics for the state. We fill in information, and this is just based on prevalence rates and population. So we take care of that piece for you. But there's some pieces in pink that the states themselves need to figure out and fill out, because I don't know. I don't have a way of knowing that without being in the state. The second page is, again, what agencies, what organizations, what programs in the state would be impacted by this bill and could apply for funding under this bill. So again, some states have that information, some states don't. That's okay, but it's a good idea to start building that knowledge base so that you're ready for when the bill hits. Strategic advocacy is still going on. We are actively advocating to members of the Health Committee and members of the Health Subcommittee in Energy and Commerce, because that's the committee that this bill is going to need to go through. And just looking at key states, and I've missed a couple here, we've hit most of the states, the ones with the stars. And again, there's a couple of states that I hadn't filled stars in yet on, I'm very sorry. But these are states that we've started working with to start reaching out to those lawmakers, or we've had meetings with those lawmakers, or we're actively working towards that. So my plan is over the next 2 weeks is to actively be in contact with the states that don't have stars. So if I haven't connected with you yet, know that I will be in the next week. If not the week following, and feel free to connect back with me too. Reach out to me. In the states where there's things already going on, keep me updated, and I'll keep you updated with where we're at as well. Once the bill is introduced, we're going to want to have the broad advocacy. And this is where having that state team can be really helpful, because it can help you reach out to anybody in the state that is impacted by FASD that may want to broadly contact all the senators, all the representatives in the state. We'll have templates available for you and ready to go on a website for your parent advocates and individuals to look up, who's their representative, and then just fill in a template for a letter that they can pop off to them. We will still be wanting to have calls with senators and representatives, but we're going to open it up to every state and to every senator and every representative, because we want to get everybody on board with this. We want lots of public awareness about the bill. So using hashtag FASD respect or respect FASD when we're doing our postings on our social media. And then we're also going to be doing Senate and House briefings on FASD so that our legislators are familiar with FASD and what it is, and their aides are familiar with FASD and what it is, and how important this act can be. Step 4, coalition building, and we can actually start on this now. We don't have to wait till June. And this is kind of part of forming your state team, but it's getting letters of advocacy from disability rights groups, from maternal child health groups, from your state senators, reaching out to your federal senators and your representatives, asking them to support this bill. But it's really broadening that approach and making sure that we're leaving no stone unturned. Writing letters, having businesses support the FASD Respect Act. And we're going to provide you with templates, again, so that it's very easy to just pop the information in the template and send it off. Right now, I'm working on adding to the Policy and Training Center website. So we will have a designated place to go, and it's much more user-friendly in terms of getting this information, and also having a place state by state where you can get information specific to your state. So in terms of support, the state leave behind document, I get that completely started for you. And that's a document that we can work on together online. I do have templates for reaching out to legislators, and I'm working on new ones for when we're doing more of our broad-based advocacy. Those should be out in the next week or so. If you're having a call with a senator or a representative, or even a state senator, and you would like an agenda to look at so that you're following an agenda for the call, or you'd like a practice session to run through it and get some feedback, absolutely, that's something that we can help with. Coordinating any materials you may need, because chances are if you need it in your state, somebody else is going to need it in their state. So that would be just reaching out to me and saying, hey, I need this. Do you have something? And I might work with you to build it, or I might already have something that somebody else has used. So I'm really here for support. We're here for support. This isn't something that NOFAS on its own can pass and get this bill passed. This is something where we're all going to need to really work together and get everybody involved in getting this passed and then getting it implemented. Because even if we get the bill passed, we still have work to do in getting those state systems of care built up. And so anything I can do to support you in that, that's what I'm here for. Any questions on any of the advocacy going on right now?
Can I ask a question about sort of the timeline, and if you're starting close to ground zero with your state system, and like how long all this would take and when you would be ready for funding, and like how much time you would have to get a good state group going?
I can give you an answer to that. So I think that maybe rather than having a timeline for doing that, I think it's important that we look at starting now, figuring out where you're at and getting started on it, because this is not something that I think you want to wait on.
I'm asking that because I think it takes a while to develop those relationships and get them on board. And then in the back of my mind, if you're going to allocate money to the states, like when do you need to be ready at that? How long will all that take? I have no idea.
Well, and I think that's why we need to be starting to build those relationships now if we don't already have them. So, reaching out to your state board of education, reaching out to your department.
I agree with you totally on that. I just wonder, like, what's the end point? Like, well,
the funding would hit, and correct me if I'm wrong here on this, Susan, but funding would hit fiscal year 2022. So
That
you'd be
starts
looking.
July or something like that, or when does that start?
That starts September, let's see. Tom, that's September 1st or
2022?
2022?
Assuming that we're successful here and there's either new money or the money that would be appropriated because of the new authorization. If it were in fiscal 22, that starts September, the end of October 1 of this year. However, it's been perhaps a couple of decades since the appropriation bills have ever been completed on time. And as you know, you maybe heard of the term continuing resolution. There's some years in which there is no new bill. It's just the funding levels from the previous years are continued through that year. So then if the money, let's say by the end of this calendar year, you have the fiscal 22 appropriations completed, then monies might be available to the agencies. They would then have to write notices of opportunities. They maybe are published in the spring, even late spring, and then it will respond. So the very earliest that money might hit the street, so to speak, and folks would be asked to respond with a proposal or a submission, I would say would be approximately a year from now or a year and a month or two. But it's probably more likely that it would be the following year.
Like September of 22 or later than that?
Well, it would probably, if we're successful here, and by that I mean all of us as advocates and bills are passed and monies are appropriated, I would forecast that it would be 2 years from now, the late winter, spring of 23, in which all that money had been digested by the system and turned into opportunities, grants, cooperative agreements, and contracts that would be available for the field to respond to. But
Okay.
very likely could be a year from now that you could see some of that.
Okay, thank you.
I mean, we advocated for that million for HRSA and that was, Tom, correct me if I'm wrong, was that a year ago? And then it was.
Yeah, that was about a 1 year turnaround. Basically, we were successful in getting that in the summer, fall of 19, and then that HRSA put out the RFP in what was it, April or May
April,
2020, and then folks responded by June. And last summer, our friends and colleagues in Massachusetts and Minnesota were successful.
Right.
And if the legislation passes, when would that be?
That's the $64 million question.
Okay, sorry.
Well, Susan Ellsworth
I
brought
need
something.
a crystal ball.
Yeah.
I mean, if we have the hearings this summer, I mean, it could very well, I mean, our goal is obviously to pass it and, both through the policy and appropriation, before the next, before the end of the year. And
Well, Susan, if I could add something to that, because it pertains, I got a really good question from who asked that question? Francis D asked the question to me, sent it to me. So it's related to that. On the hill, the squeaky wheel gets the oil.
yeah,
It is what it is. Okay. So, if you look at why things happen quickly, they respond to a large amount of input that comes their way at any single time. So take advantage of, if we want to keep this thing moving, and I think there is a good potential. There's more attention with this. There's more unity. We just look at the number of people that we have on this on here today, and we're at what, 51 people right now that have joined us. That's huge. So when you take a look at this as a grassroots advocacy kind of thing, take advantage of all the opportunities you have to engage, to include. And this is where I said, Back in the day when I was on the Hill, it was snail mail and faxes. I mean, who even does faxes anymore? I mean, snail mail still arrives, okay? But now that's been replaced by email. The messaging boards, info at blah, 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 that address. You can do that. But if you want this to move fast and get their attention, use the social media platforms that are out there. If you've got a Twitter account, follow that member of Congress, and every now and then send them a direct message. You might think they don't pay attention. They do. Either if they don't, they have a staffer assigned to Twitter. They have a staffer that's assigned to all their social media, Facebook, Instagram. All those different things are things that members of, even my old boss, Don Young, who's the longest serving member at age 82, 83, 84 right now, has somebody posting on Instagram and Facebook right now. So, which means they're monitoring the responses and so forth. So please use those opportunities, and all it takes is for you to kind of just throw things in there. Even when you make comments, they say, hey, we're getting ready to do some work on healthcare. Put in there, hey, it'd be great if we could do this with FASD. Have you got something FASD? Hey, we're about to appropriate money to defense. Hey, there's this great program that FASD is working on having to do with that. So we're about to do something for COVID. Hey, what about this as a part of that? That would be great. So even if it's not related, you can find, trust me, if you read some of the Twitter comments, they find ways to take things and make it related somehow. If they can do it, you can do it. Somebody's paying attention. The more we get to them, the more we tell them why this is important, the more they pay attention and they go, okay, what's going on here? It grabbed their attention. So use social media to do that. That'll help accelerate this at least keep it on a schedule that, we're going to see some change. That's the way to do it. Questions on that one?
Well, on that note, I just wonder, we had discussed this earlier, I think, about having an article like in the Washington Post or something just before the bill is introduced, which quotes those senators who are supporting this bill. That'll go across social media big time. And, that's another way. And it's, a source like the Washington Post, would be a great forum. Would something like that be useful, do you think, Susan? Or
I would say absolutely. And that being said, the other way to do it too, and you said that very well, also somehow getting into your local newspapers, also the local news media, that also helps. So if you've got connectivity into that, the unfortunate, well, it's not unfortunate, it is what it is. Washington, WAPO is viewed as a left-leaning, and politics gets into it. WAPO is viewed as left-leaning, Examiner in the DC area is viewed as right-leaning. Make sure you hit both. This is not, FASD doesn't care what your political party you belong to. It could care less. But unfortunately, there are politicians who care what media is advertising something and don't recognize that. So we don't want this to take a partisan flavor. We want it to be bipartisan. Whatever you send to WAPO, you'd want to send it to the Examiner also.
Yes, and NOFAS will be doing this. NOFAS prepared, obviously, press releases. We did articles. Unfortunately, as the bill in the past had been introduced, we came up on COVID a year ago from now, and shut out some opportunities. But yes, that's a very important component of trying to market this bill and gain your attention. I think it's so important, and I don't know that Mike properly introduced himself. Mike Anderson, he's a member of the NOFAS policy team, key person. Those of you who've been on these other calls have heard from him. He's one of the people who really helps us be opportunistic on the Hill, because you cannot script and you cannot predict this process, and you have to be nimble and you have to be ready when people that you were working with may say, hey, there's an opportunity here to connect maybe, or to link or attach your bill or its provisions to this other piece of legislation that's moving. And so that is one of the things that NOFAS is doing sort of behind the scenes, constantly talking to the offices of the authors and folks on committees to try to find out how we can take advantage of other legislation and the moment, but you can't take advantage of the moment if you don't have any visibility. So Mike's point about, and I love Jen's term, sort of friendly to FAS or FASD friendly. We've got to find those people. We've got to engage with them. We got to let them know it matters and that this is coming along the way. Don't know maybe exactly what day, and I'm not just talking about the introduction, but we need you, we're going to need you, and you got to be active and ready. So that's part of what we're doing at NOFAS here in Washington, and part of what we want everyone to be prepared for. And can I just mention that in the chat, there are a handful of people who said, hey, look, I'm ready to go, put me to work. And I would say, and Jen, maybe you don't like to hear this, but get in touch with Jen. If she hasn't already talked with you, she is activating people with these Zoom meetings and connections with key staff for their representatives and their senators. And as you also heard her say, she's sort of rebuilding a website that's going to be user-friendly and full of information, including call to action with a description of, okay, now is the time to do A, B, or C. Here is a guidance for how to write an email or for talking points for a telephone conversation with a staff member. Or if it's easier for you, here is the script. You just plug in your name and a couple of other points of information. All of that will be posted ahead of the introduction of the bill. That means in the coming weeks. So again, so anyone who's mentioned, hey, put me to work, go to Jen. She'll at least get you, on the list. May not be immediate that we can get a meeting set up with you, because you heard her say, we're trying to organize these states with all these different folks, and with, I think, the families and the advocates, you are the leaders, the top of this pyramid, the key person and key people into, I think, attracting others to our cause. So
I wanted to say something that that all politics are local, and
Yep.
that part of the march of advocacy that starting in just such a very close space like your Board of Supervisors meetings, that that FASD came up through our advocacy for jail reform. And it was that there's never a lens for disability for jail and for the incarcerated, that we look at mentally ill, we look at criminality, we look at all that, but we so rarely look at the lens of disability and how it impacts all of our systems, particularly the incarcerated. We know the numbers are huge. And so one of the basic building blocks of advocacy is showing up. And if there's something we can do as retired people is showing up. We can't do it now because of COVID, but sitting in that supervisor's chambers month after month after month and developing a relationship with those supervisors led to Santa Clara County now approaching FASD as a public health concern, and constructing systems that are going from media to housing and so on. And so that president, that board, those Board of Supervisors know the state senators. Cindy knows Dave. Dave knows Zoe. They're all connected. They're all from here. They all know each other. And what we have found is that when we look at FASD from that 35,000 foot level, as we need to change the entire system, there's kind of this, yeah, I believe in that. But when you give them a bite, the bite that says, and for us, it's the OHI, putting FASD under OHI, then going from that macro to that micro, this is something you can do that will change all kinds of systems. If it doesn't start in schools, it doesn't go anywhere very fast. So I just wanted to throw that out there, that we look at the great big enchilada, but when we can start breaking it down to relationships, that's the power is in the relationship.
I think that is brilliant advice, Barbara. The power is absolutely in the relationship.
The
Yeah,
cornerstone to advocacy.
Yeah, and I would just say, based on all of our experiences with all our meetings, It's just it's all those connections, and the more you do it, the more connections you find, and it just is multiplying. And it has to be, I think it has to be just choreographed from the, from the bottom up and top down. And I just can't say enough for, what the advocates have been doing. I mean, it's going to, and it has to be personal with the members of Congress. I mean, they have relationships with other members of Congress, and that's been helpful as well. And we're learning that it truly is a bipartisan effort. I mean, the meeting we had yesterday with Representative Jackson, he says, well, now Don Young's supporting this. I said, yeah, he is. Oh, well, then and so it's multiple factors. And I think we need to, as we're doing this, just keep that in mind. It's not just one.
And in so many ways, it's a very small group of people. One knows the other, knows the other, knows the other. And with the immense problems that we have to resolve, this is just one, and breaking it down to a place that says we can do this piece. And it's slow. It's so slow. It's so slow, but it marches along, and it's our faithfulness to the cause that is really noticed. You're here again? Yeah. You're here again? Yeah. Yeah.
Excellent. Well, out of respect for time, if there's no other questions, I've kind of kept an eye on the chat, and I'm going to work on some of the questions that came up in the chat too. If there's no other questions, I think I will call it, and just really want to thank everybody for being here, and thank everyone for their advocacy and their kindness with my learning curve, and all of your support.
And was Wisconsin one of the states you already talked to?
Absolutely. We've got a meeting coming up in Wisconsin through Orchid's FASD, through the affiliate there. Yeah.
Just don't call Jen. She's on the West Coast, so she got a text at 3 a.m. The day before. So just keep that in mind.
Trust me, I know that feeling. It happens to me all the time.
Thank you.
I
All.
can call beforehand. I just probably won't answer the phone.
How do we request a copy of the state's leave behind form?
Heather, shoot me an email, and I'd be happy
Perfect.
to do that. What state are you in?
Colorado.
Colorado, perfect. Illuminate Colorado, work with us on that. And I believe it's all done. And yeah, I can get a copy of that over to you.
Can you share the PowerPoint presentation so I can remember things better?
Yes, the plan is to share that as well.
And I'll call Jackie Willie since I'm in Wisconsin, but there's a great lady who works she used to be with the Department of Health, and she's now with the University of Wisconsin. Her name is Bernstein Jaffers, and she's in charge of all the women's issues, and she'd be great to work with also.
Awesome. And I think Cole Stofflet is on the call, and Cole is working with Jackie. So the two of you can connect. See, it's all about connections.
Totally.
All right. Well, thank you very much, everybody.
Okay, thank you. See you next month.
Bye.
Bye.
Thank
Thanks.
you.
Bye. Thank you.